time, go.
Many girls them try to come my way. Oh, yeah. Some fine, some bad, but that's why your time never there. That's why I bless the day I found you. Let's go. Oh Lord have mercy. But don't see me who I am. Up on my girls for your love, yes Lord. Oh, now me do to you, sing me Jimmy. Oh baby girl, and your friend me tall again. Me what tall again, me need a sword in a never me need nobody but you. I wonder if you think say I believe you. Saga with it. Me I would do it, girl, I'm yet to stay. Lord, if I leave you, make thunder fire, fire. Baby, if I leave you, make thunder fire, fire. See, I will fight for your love. I could go for your love. I could give up on my girls for your love. Yes, Lord. See, I could fight for your love. I could go for your love. I could give up on my girls for your love. Are you ready to listen, my
Buy an interest-free home and pay within 36 months. Yes, Daimler Homes' new gold standard development, Hilton Court, has just commenced, and you can own a unit now and pay within 36 months without any interest. Starting at 95,000, you can own an elegant apartment, and guess what? Discounts are available from now till end of May. To learn more, visit our website at daimlerhomesgh.com or call us on 0200 584 558. Daimler Homes, the elegance of living.
Attention UK! The countdown to the most glamorous event of the year has begun. AKOSUA Concepts proudly presents the 7th edition of December to Remember UK. Mark your calendars for Friday 20th December 2024 at the Lavish Shack 89 in Mitcham from 5 p.m. until 3 a.m. Grab your tickets now. Standard for £80, couples for £150, or book an exclusive table for 12 at £1,500. This is your night to shine. So dress to impress and get ready for a holiday celebration like no other. Tickets are flying, so don't miss out. Head to d2ruk.eventbrite.com to secure yours. Sponsors: Access Financial Services, DiasporaInsurance.com, Purple Scaled Staffing, Tap Send,
Your favorite way to send money to Ghana is back. We're excited to announce that Tap Send is back and better than ever. After a brief pause, we are happy to resume our mission of providing fast, affordable, and secure money transfers to Ghana. Don't let anybody tell you otherwise. Tap Send is working power. And remember, tell your loved ones abroad to send money through Tap Send to stand a chance to win big in the December Sambra promo. Tap Send. Papa no.
Hello, and good evening, everybody. So my name is Abena, and
I'm Akos.
And together we are the Oasis, and welcome back to our weekly health talk show. So today is sorry, my eyes. So today is our final show just before the Christmas break, and we have got a bang for you guys. So today we've got about 4 doctors.
Yeah.
Including our resident doctor, Dr. Kodzo.
Check yourself out. So we've got 5 doctors in total. Actually, no, we don't. We have 4 doctors. So Dr. Kodzo would like to send his apologies. He was called in last minute, as you know, the way our job works, but he's had to go in last minute. So Dr. Kodzo is not able to be here today. So he's asked me to send his apologies. So if you've got any questions, just ask and we'll see if he can answer it anyway on the OT Media WhatsApp chat. Later.
Yeah, it's unfortunate.
We've still got 4 doctors, so
yeah, Dr. Kodzo has been with us throughout the year, though, those of us who've been our faithful watchers. But before we introduce our special guest, just a few housekeeping things. So first of all, would like to welcome everybody and welcome back to our special consistent, should I say, supporters and viewers who watch us. Thank you for being here week in, week out. Want to also thank Tap Send, who sponsor the show, and OT Media for this opportunity. So now, without further ado, we will be introducing our guests, and today we're going to do it a bit different. I'll try and bring a bit of Tree, but not everybody here speaks Tree, so I'll try and mix English and Tree. But today our show will be a little bit different, and there are something called Q&As, so questions and answers, which means that we'll have a panel of doctors, which we'll introduce to you very soon. And you can ask any question, literally any health question. So today is literally just bring your questions. The doctors are here to answer. We want it to be very interactive, and we want you to just ask as many questions and just make the show a great one. And hopefully everyone will be blessed by the end of it, and we'll all depart and knowing more about our health. And so, without further ado, should we bring on our doctors?
Yep. So we've got Dr. Blessings on. I can see Dr. Yvonne's here as well. Dr. Mustafa was on. Oh, okay, he's here as well, so I can see. And if the doctors don't mind turning the cameras on, I know that Yvonne's already turned the camera on. Musti and Blessing, please turn your cameras on so we can see you. And I know today we're giving OT Media a headache because I don't know how they're going to fit all of us on one screen. So sorry, OT Media, but yeah, I know you'll try for us. Yeah. So hello, Blessing. I'm going to start off. Let me actually see. I'm going to start off well, I don't need to introduce myself.
So first of all, yes, go on. Sorry, I was just going to say, just so today, Dr. Akosu will be part of the doctor, so technically I'm hosting by myself. And usually Dr. Akosu hosts with me. But today, since we are one doctor short, Dr. Akosu will be taking the place of Dr. Kodzo. So, doctors, what I would love to do, starting with Dr. Eke, who has volunteered herself as the sacrificial lamb, to start is to say your names, what you do, your special interest, and I think that will give the audiences some kind of idea. And then as the questions come by, we can sort of allocate sorts, or whoever wants to be brave and answer can go ahead and answer. So please, doctors, go on.
Okay, so my name is Dr. Well, I'm well known as Dr. Akos. Full name AKOSUA OFOSU-ASIEDU. I am a GP trainee at West Midlands. And essentially, I think I've been with you guys here. I'm your resident doctor, so you guys know most about me. But just for people who might be signing on for the first time, I am interested in quite a few things, hence why I decided to become a general practitioner. In other places in the world, I know we've got other people watching, so people from America, Italy, and other places. GP in the UK is just basically a family doctor, so family medicine. But I do have interest in sports medicine and women's health as well. So anything to do with bones, muscles, or women's health, feel free to ask me.
Yeah, thank you, Doctor.
I'd like to nominate Blessing to go after me.
Excellent. Please, doctors, nominate each other, as I cannot see you guys on my screen today. I'm using my phone.
I saw that comment already. Thank you very much. Welcome, everyone. My name is PRAH Blessing Baden, and I have a social interest in trauma and orthopedics. So I'm quite in line with AKOSUA. He does with muscles and bones as well as me. Yeah. So please do and channel your questions on bones and muscles and stuff. Like if you go to human health, I remain silent throughout the. Thank you very much.
Surely, Dr. Blessing, you can tell us a little bit more. Even if the question is, basic human health, you can help us.
I'll try.
Anyway, welcome back, Dr. Blessing. Thank you very much for coming on. Please nominate a doctor.
Of course, she left with Yvonne.
Okay, Dr. Yvonne.
I think you're on mute. Hold on a minute. Let me try and unmute you. There, it's on mute now. Yeah.
Hi, everyone. So I'm Yvonne OPPONG-YEBOAH. I'm also a GP trainee here in the West Midlands, and my special interest is mental health, basically. Yeah.
Oh, lovely. Thank you, Dr. Yvonne, and thank you for coming on the show, and welcome.
It's her first time on the show with us today, so I just want us to show her a really good time, show her how fun our audiences can be. Okay, and yeah, thank you for coming on the show, Yvonne.
Yeah, absolutely. Thank you for coming on the show. We love to have you here. We may have you on more if you want to next year. But I love the fact mental health is a very big topic, so I definitely would like to delve into that a lot more. But yeah, thank you very much. And last but not least, Dr. Mustapha.
I'm happy. I'm not pleased. I'm happy to see Mustapha tonight. I'm happy to, all right, you later on we'll talk Mustapha. Continue.
Dr. Mustapha.
My greetings to you all. Anyways, Mustapha, I'm a GP trainee here in Switzerland. I don't have any specialty interests at the moment. I just love human beings, and I've decided to dedicate the rest of my life for the well-being of mankind. Thank you.
Excellent. It means all our questions will be channeled to Dr. Mustapha, as he loves.
I will be very happy to refer them when necessary.
Mustapha is very good with sort of general medicine, internal medicine. So anything to do with anywhere in the body, literally kidneys, heart, everywhere. Just ask Mustapha. He knows everything.
So for my audience, sorry, I said semen mixing with tree, but as you can tell, my tree is not really mixing. So I'm speaking more English than anything. But I will try and shoot one or two words here or there. But see, without further ado, I think we can start taking questions. Or do the doctors want to sort of give some kind of intro chat, or just straight into the questions?
Just straight. So today's so obviously throughout the whole year we've been doing talks, and then people are able to ask us questions. Today it's just Ask the Doctor. So essentially it's just a free clinic for you to come in, ask any questions. It doesn't have to be personal as well. If you feel like you've read something online, or if a friend has been discussing something with you, if you want to be anonymous, send it into our messages privately. Just ask any question, and there's no such thing as a stupid question or a silly question. So we're here for you. Ask anything you'd ever want to ask a doctor. That's what we're here for.
Excellent. So, audiences, shall we begin? I think our audiences didn't expect this.
I think we've got a raised hand.
We do. Oh, lovely. Excellent. I love it. Shall we? I'm using my phone today, so apologies.
Oh, yeah. Sorry. I'll help you. Yeah. Adepa,
I'm a bit slow to see this. But Adepa, please. You have the floor.
Okay. Hello, doctors. Good evening.
Hi.
Good evening, everyone. So my question is just, I've seen a lot of things going on up with how autism, like with childhood immunization. They said that it's due to it causes autism. I don't know if you've seen or heard. So I just want to clarify that. Does it have any relation with autism, like if children having immunization? Because people are really keen that it's not good to have the childhood immunization, like don't give them to your children. So I just want to ask, please.
Yvonne, I'll send this a question.
Wow, Dr. Blessing will be doing allocation today.
She did not say that she was an immunization specialist. I don't mind taking this one. Okay, I'll take it.
And then I'll add on if I need to.
Okay, fine. Oh, do you want to go? Do you want to take this one?
No, it's fine.
Yeah, so this is an interesting question because I remember when I went to immunize my son, and the nurse who was doing the immunization, the one who was actually giving me the immunization, then asked me, she said, "Oh, since you're a doctor, can I ask you a question?" I said, "Yeah, sure, go ahead." And she said, "A lot of our patients have declined the immunization because, you know, they're coming in saying that this is causing autism and stuff. So can you tell me a bit more? Does this really cause autism?" And I'm thinking, this is the nurse who's actually immunizing my son, who doesn't know. So it's not like, you know, it's quite an important question. And I actually wanted to do I'll probably do a different section on children immunization later on next year. But to answer the question, it made me go and read a bit more about it. Now, as a medical student, I remember there was a study which came out which said that it was for a long time ago, but it said that the measles, mumps and rubella vaccine is linked to autism and causing autism in children. However, that study has since been debunked. Since 2003, there's been another study which has looked at a larger population, larger numbers, and has found no link from any immunization in children to autism, and has found no link specifically from the mumps, measles, and rubella vaccine to autism. Now, if you think about the whole vaccination topic in itself, is quite an interesting topic, and I think it's quite a contradictory topic because there are so many anti-vaxxers out there, people who don't really trust vaccines, especially within the Black communities, because there were histories back in the day of how some of these vaccines were actually tested on Black people, especially before, like, so almost like using us as animal studies. So there's no, you know, there's actually a valid reason why Black communities, certainly here in the UK and sort of in the Western world, do not trust vaccines. But from my experience, there is no link between vaccines and autism. Simply put, that's the simple answer for it. I don't know if any other doctor wants to add anything on.
So I just wanted to add on to that. The reason why that is sort of the notion out there is generally as science progresses, right? We've been able to diagnose more cases of autism, and it was found that around the same time that children get the MMR vaccine, that's when more people were being diagnosed. So some people sort of did a research to find out if there was a link or not. But as Akos rightly said, it has been debunked so far. So it's quite safe to give your children. Yeah.
Nice. Thank you, Adepa. Dr. Blessing, Dr. Mustapha, anything to add, or we are good to go?
Yeah, I think I don't know. It's Mustapha or AKOSUA, whether like you know this woman. She's in the UK. Mustapha, like I don't know. It's called like Sandra. He said he was in Ukraine, but because of the war, he left to UK. Back, they live in the UK. Like the mother has like two kids, boys. One have autism. The other one doesn't have. And now this happened. Like the first time after the birth, they gave like immunization right after birth. They gave immunization, and he has autism. The second one during birth, they didn't give an immunization, and he is fine. So with this kind of mom, it is difficult to prove her wrong that whether it's this or that. When I say like I don't know whether indeed the autism was caused by the immunization. Even for example, this like being a stammer, like people don't know the cause of how people stammer and stuff. But all I know that it has to do with the brain. And for me, for example, they said like when I was according to my mom, I was the only one who wasn't born at the hospital. I was born at home. You understand? So this is what my mom said, okay, that is why, because of the infection, all this thing. That's what they told my mom, because I wasn't born at the hospital. That is why. So you understand? So for example, my mom, no matter now my mom, any small thing, you have to go to the hospital. all his friends, go, my son blessing, I didn't give birth to be at the hospital. Now he's done. You understand the point? So although there's a research to back everything, but people, no matter what you do to them, they have experienced it. What they've been through. I'm not saying the researches are wrong. They are right. I support it, like from a medical point. But sometimes some people, based on what they have experienced.
Yeah. I mean, I get your point, Blessing, and it could be coincidental, and like there are instances like that as well. I mean, like I always say, it's funny because I find that every year, if I don't take the flu vaccine, I'm actually okay. The year that I take the flu vaccine, I get the flu the worst. So I've kind of come to a conclusion myself. but the funny, but like you say, but the funny thing is, there really is no correlation, and it's just, it really is. Anyway, so it's one of these things. I totally understand what you mean, Blessing, but I think there's some people you just can't win with, and it's from their own personal experiences, and that's fine. But like you say, from the research that we have, and we can only talk on the facts and the numbers that we have. So that's obviously the advice that we will give according to the statistics. Yeah. I think, Abdullah, can you see Letty's got her?
Yeah, I do. I just wanted you guys to finish the discussion. Okay, that's fine. Thank you, doctors. Letty.
Okay. Good evening, doctors, and good evening, everyone. As Dr. Kos, you just said about the nasal flu, because my daughter had it last week. She didn't had any flu, but as soon as she got that nasal thing, the flu that she's having is very, very serious, and we can't sleep at night. So
sorry, what's the question?
I said my daughter.
Yeah, no, I understand. But are you asking that is
why? Yes, yeah. Why is that?
I think I can take that.
Okay. Okay, go on. Staff, we can't see you.
I was gonna say, Doctor, we would love to see your face while you take that question.
Your handsome face.
I love the compliments. Thank you. Anyways, I think, first of all, we need to understand what kind of vaccine is the influenza vaccine. It's an inactivated virus. So it's a virus that is taken, inactivated, and then it's put inside your body. The the symptoms that we experience during flu is mainly because of the immune reaction or the body's reaction to protect us or to kill the viruses that come to your body. So after an injection, or after we inject you with the inactivated virus, either way it's a virus and the body is going to perceive it as a virus. Mm-hmm. And the idea of making of vaccines is that we give you that virus, the body reacts to it, and then it can keep in its memory the reaction in for future purposes, so that in case the baby or someone has the same flu in the future, the body could immediately react. So what you are seeing right now is the reaction of your body, of your child's body, to a usual flu infection. However, this time the virus is not active. It is normal or it's mostly a side effect that is seen when people are given flu shots and so on. I think it's something that would go with time, but just understand that it is the body's reaction against it. Now, the reason why we give vaccines for children is mainly to avoid the complications in the future. So right at this moment, we are not saying that in the future your child would never get influenza. They would get influenza. However, the body would have already prepared itself. The body already has a memory on how to fight it for the future, in the future. So the reaction now is just a body reaction to someone who has usual flu. And I think that is also a good sign that the body is strong and is reacting well.
But just a correction, everything that Mustafa said was right. But this nasal spray, which you said is actually an attenuated live, so it's not an inactive. It's a live virus, but it's a weakened one, so it still can't cause the flu. So everything that Mustafa said still stands. But just to make that, because I don't think Mustafa you heard that, but she had the nasal vaccine as opposed to like the normal vaccine. So the nasal is the live vaccine. Okay. Yeah.
Okay. Thank you so much.
And then please, I have people always say that as Lalotti said that because he has the vaccine, so they think, okay, don't have an infection or something in the future. Let's say we are all like adults here. Sometimes like we go use our protection, having sex and stuff. But sometimes let's say the condom like get busted and then you get into pregnancy and stuff. I remember like I'm preparing to do my residency. So I've started like meeting like the board for interview and stuff. So I appear on the board on Tuesday, and then they ask me like, why do you like scrap in like put gloves in hand? And I told them like is to like prevent infection. After meeting the board, they gave me the result. They told me we wash our hand and like putting gloves doesn't mean we are preventing infection. You can never prevent an infection, but just to reduce an infection. You understand? There's no way you can prevent infection totally during surgery or other things, but just to reduce an infection. So you're giving the vaccination doesn't mean, okay, you are free from the disease or something. As Mustafa explained, just giving what you have to reduce, you got it in the future. Just to reduce the amount of bacteria that may enter during surgery.
Just to add to that, normally when I talk about vaccine, I just explain it as a group of soldiers. We just want to prepare the group of soldiers for a war in the future. So you have soldiers, but they are not trained yet. And then you give them the vaccines so that they develop a specific tactic in place so that in the future, when war comes, they could immediately know how to organize themselves here and there. So again, I will use this opportunity to also talk about corona vaccines, because some people don't want to take the corona vaccine because they will still get corona either way. Things will still be worse either way. The idea is just to train the body to prepare itself for the future battle. Thank you.
Thank you, doctors. Thank you, Letty. Is that okay?
Yes, that's fine.
Yeah.
Can I ask another question, or
please go ahead? As many questions as you want.
Then I'll come back. Wait until Liz, then I'll come back again.
Okay, no problem. Thank you. Thank you. Auntie Liz.
Hello, everyone. Good evening. I just want to add or ask doctors, since I'm not one of you, me and Abra, but we are still.
We're still here. We're still here.
We are supporting. We are supporting. Yes, a nurse told me once that when you take the vaccine, it takes about 2 weeks to have effect. So within that time, maybe you've come into contact with someone who is infected, and you may have that. So having the vaccine and having the flu, maybe you were going to have it before you had the vaccine, but because you've had it, you think it gave you the flu, but it won't get into effect until maybe after 2 weeks to be able to prevent you from getting severe flu. Doctors, is that true?
Yes, vaccines take 2 weeks, roughly 2 weeks to kick in place. And I always say, even with the whole vaccine thing, so a lot of the time, when people come to see me, they say, oh, I feel like I'm getting a bit of a cold. Is it okay for me to take my vaccine? Now, if you're taking like the live one, like the nasal spray one, then usually they say if you're having like symptoms of not feeling well, if you're like you've already got a weakened immune system, then you should generally avoid taking sort of live vaccines because your immune system's already weak. So yeah, they advise against that. So you're quite right. Imagine that maybe you've got a bit of a cold. You actually don't know because I think that the cold has a bit of an incubation period as well. So sometimes you can have it and not really know that you're coming to get it. So let's say you came to contact with somebody yesterday, you're starting to feel a bit sniffly, but you're not really sure. Then you go and get the vaccine today, and then like you're actually already about to get a cold, but you actually didn't know that. So then you've gotten the cold and you're thinking it's because you've taken the vaccine. It's actually maybe because you had a brewing virus. That's why we're saying all these things as medicine is not 100% and it's not an exact science. But all that we can say is that we know that the vaccines are good for you. We know that they can help you fight the cold. And if you do take the vaccine and you don't you don't get the cold and you take the vaccine, even if you do come into contact with the cold and you get infected, you will not become as ill as you would if you had not taken the vaccine because your body is already used to the virus. It's already fought the virus before. It's always like maybe as a Ghana football match, Nigeria. We say, so, oh, Nigeria for the anymore. We know the way they play. We know their defense. We know their attacking skills. That's the same with the vaccine. The vaccine, that's what the vaccine does. The vaccine gives you a first match with your body, gives your body a first match with the virus. So if your body then comes into contact with the virus a second time, your body is like, oh, meaning I know how to kill you. I know how to do it. So the body can quickly do it. As opposed to if you haven't taken the vaccine and your body comes into the first contact with a live vaccine, then your body really struggles because your body in share virus, so it doesn't know how to react. So I think that's the only thing I'll add to what others have said.
Okay, please. I'm a doctor myself, but I want to ask a question, please.
Will it be allowed on my show? Of course. Continue.
Wait, Auntie Letty had a question. Let her ask first.
Okay, sure. Sorry, Sorry, mommy.
Oh no, you can.
Okay.
I mean, yeah.
Based on what you are saying, I know that we have like maybe antibiotic like resistance. We also have like immunization resistance.
Immunization resistant.
Yeah.
That's an important point because you know what? Yeah, I'm gonna tell the truth and say I've never actually come across that. You might be right, but I can imagine that might be a thing because if you think about the flu virus, right? And like my mom is 70 years old, and the flu vaccine, every year there's a new booster. Every year there's flu. So I think you'll get to a point where your body might say is enough. I don't know. That's the truth. I don't know if anybody else has heard of it, but I guess, Blessing, if you're asking about it, maybe you've heard about it. So.
No, honestly, no. I'm asking because like there's a case I was discussing with Mustafa and like my boys in the group some like 3 months ago, and then like today the issue was solved. And then I wanted to like that's why it came to my mind. Yeah.
Okay, call me after. I want to know the issue.
Like mainly for boys group.
Yeah, very interesting point, doctors. Anybody has anything else on the matter? Dr. Yvonne, Dr. Mustafa, what's it called? Immunization resistance. That's quite a
Never heard of it.
Immunization resistance, Blessing. How would you define it? What is it in general? First of all, I need to understand the concept.
Okay.
Oh no, relax, because Blessing is an orthopedic surgeon, so I need to confirm his definition first.
Mustafa, let me say, we have, let's say, like antibiotic resistant to some disease. All right.
Okay, that if you give the antibiotics, the person, it will not act.
Exactly.
Right?
So, yes. So like, let's say, is the case of, let's say, like, if you get too much of immunization, like, let's say, that's in the case some of the infection or some of the things get like they become resistant. They don't more work again.
Can I? Come in. Oh, sorry. Go on, Mustafa.
I think theoretically, I don't see the possibility in it because either way, the immunizations that we normally do, if we are doing immunization several times, the idea is to do a boosting system. However, I would understand things like someone has a disease where there's an immunosuppression, and so the vaccination is not really as effective as it should be, or maybe there is a change in the receptors in the future, but I don't...
Gentlemen, immunosuppression, please, we are all not doctor. Layman, immunosuppression, whatever is going on here. Please help us to follow the conversation. Thank you.
Okay, just so I rephrase myself. If you want me to, so you see, when you give the vaccine, right, the body's immune system, as the body's soldiers are supposed to come up and then fight and learn from the vaccine. So they need to organize themselves, learn on how to fight in the future. However, in case you give a vaccine, and then, so the idea of boosters, where Blessing is saying when you give several vaccines in the future, is just to retrain the soldiers again, to prepare them. Soldiers no shall 10 years, no more. You need to show them again the tactics. That's why Ghana military, they don't fight, but they are always training.
Yeah.
Anyways, so that's the idea. However, if in the future the person has an autoimmune disease, to my own theory, I think it's, first of all, it's not
autoimmune, meaning that the body is fighting against itself.
Fine.
So autoimmune, in this case, right? Yes. In this case, I'm using the same soldiers, saying that if in case the soldiers have been hurt or they've been reduced, in either way, when you do the vaccine again, they cannot organize themselves to develop a tactic. So in that case, you might say that there is a resistance, but theoretically, I don't see the possibility.
Okay.
On that note, I actually remembered something from when I was in medical school. Sorry, but actually, I think there is a resistance. The reason I say this is because that's the reason why every year we develop a new vaccine for the flu. Because if you think about the flu, every year the flu the flu virus changes, or as in it becomes. So, for example, we have a vaccine for the flu, like this year we have influenza A vaccine, right? And then next year, if influenza A comes back again, we have to get a new vaccine. Why? Because the flu virus has changed, because it's become resistant to the current vaccine that we have. And that's, I guess we maybe did not understand the question from the point of view that you asked it. But so things like MMR, like rubella, those things, they don't change. So we have a vaccine, polio, they don't change. Chickenpox, we have a vaccine that works for them because they don't change. But the flu virus is so smart in a way that it changes every year. If we give a vaccine this year, the flu virus is able to realize, this year they killed me with this vaccine. Next year it adds another antigen and it becomes new. So actually the flu virus alone, we know, actually does gain resistance to the vaccines we have. And that's why every year we have to make a new vaccine for it. If that makes sense.
Of course, for me, that's missing to me, because Mustafa, for him, he doesn't regard like trauma and orthopedic doctors. So me all the time. So from his point, I agree.
Just chipping here, but then is that a human being resistant to?
No, but even if you think about antibiotic resistance, it's never about the human being resistant to the antibiotic. It's about the antibiotic. So for example, if you use like penicillin, and you've overused penicillin in your body, so the bacteria or the microorganisms in your body become resistant to whatever antibiotics we're giving you. And that's what I say. It's not about being resistant. It's not about like a whole. So you can be resistant to a particular antibiotic, but I won't be resistant to that. Right. And then there's another flip side to it, where the actual, so like MRSA, those particular organisms are actually resistant to like the antibiotic we're given. So there are different types of resistance, if that makes sense. Yeah. So in this case, in the flu sense, the influenza virus is almost like an MRSA in this case. It's actually the pathogens that become resistant to the medication, as opposed to your body becoming resistant.
The immune system itself, which I agree with, I think.
And Mustafa,
So in this case, there is, I think in the nutshell, there is still no vaccine resistance, theoretically, because No, just to say, because imagine antibiotics resistance. It's the antibiotics that are given that do not act anymore on the specific bacteria because the bacteria have changed their nature, right?
Yeah.
In the same way, the vaccine that we give, it is for the human's immune system to act against that specific
Anyway, do you know what? I think we're gonna go with what Peter Akwesi Sapon has said in the group. Hello, Peter, by the way, nice to see you. But he says that this is an evolving research, and it is true. It's evolving. It's a case that we don't like. As you can tell, doctors are really not sure.
The doctors are confused.
I know.
We can do a debate on this the whole day, so I think
Peter is a specialist in biochemistry, so he can give a lot more.
And he's the one telling us he's evolving research, so we should move on.
So he's not sure. Okay.
MUSTAPHA, is that the Sapon we know?
Yeah, it's the one. It's the one.
Oh, I see. Interesting. Nice to meet you, dog.
Wow, what a show. Thank you, doctors. We are networking while learning. It couldn't get any better. We've got our hands up by OT Media himself. OT Media, you have a question?
It looks like next year we're going to have a medical school here.
I absolutely support. I think we need to do one where none of us speak and we just listen to the doctors talk among themselves. I think it's great.
All right. I have a quick question. And this goes to Dr. Yvonne. I think we sometimes take mental health for granted. And if you haven't been through a situation, you wouldn't know how important mental health is. And coming from our community, we sometimes say obi mental health for one someone na say onipa na wabodam ana bibisa and Emma and Kofo a tank of share they don't talk about their mental health issues. What would be your advice to our community when it comes to mental health issues?
Okay, so I agree with you. There's this stigma surrounding mental health generally, not just in our community, but elsewhere as well. Another one particular place or group of people that face the stigma are also men, because society sort of wants you to be a man up in cases like don't talk about your feelings, don't express how you feel. But to everyone listening, I'll just say mental health issues are very real. On a daily basis, we see people who are struggling from mental health issues. Families have been broken up because of certain issues. People are spending so much money in the hospitals on medication. Even though our society doesn't encourage us to, take care of our health up there, they encourage everyone to, know that it's fine. It's fine to speak to people. People struggle. Some might just not come out openly and tell you, oh, this is what I've been through. This is what has happened to me. But just know that it's okay to speak. It's if you need help, just try and speak with any health professional. Even if it's a listening ear, sometimes it helps. So even though we've been taught not to, open up about some of these things, I'd encourage everyone. And as we have children, as we speak to the ones coming up also, just let them know it's okay. It's okay to, have some challenges and to speak about it and get help if you need. So that's it.
Sorry, I was muted. Excellent. Thank you very much. Yeah, thank you very much. I was going to say, does that answer your question? Okay,
yes, please.
Just to quickly comment, Dr. Yvonne's voice and the way she articulates herself really sounds like she has a lot of interest in psychiatry.
Really? I get pediatrics a lot. People see me and they're like, "Oh, you should be a pediatrician." Not me.
Go on, are you sure?
I get that a lot. Maybe because I'm tiny.
Maybe you've got the voice to calm children. Maybe that's also another one.
I was actually going to say, Media, I'm surprised you did not ask a question about women's health. Or maybe it's because Dr. Kojo is not here.
Yeah, Dr. Kojo is not here.
Okay.
But I'll come back. Dr. Mustapha is here, so I'll come back.
Excellent.
Sorry, I didn't get that.
No, he said he'll come back. Dr. Mustapha is here, so he'll come back and ask another question.
We need to drill our doctors. I've got some questions rolling through in my personal thing. I'll start slowly. I'll start with something easy for doctors. We would like to know how you doctors prevent burnout and stress. Oh, we've got a Miss Abena. Before you answer my question, let's move to Miss Abena first.
No, I think, wait, just answer, because I think that one's come into your chat a long time ago from somebody anonymous.
It has. I'm trying to pick up questions that we didn't get to. Okay, fine. Well, the question was, how do you doctors manage stress and burnout and prevent burnout?
We don't. Thank you. Next question.
That's not true. Surely.
Dr. Yvonne.
Why am I being put on the hot seat?
Because this is your fault.
Okay, so personally, come again.
No, go on. I was saying I actually don't think we do, but yeah, go on.
Yeah.
Sounds like you don't.
I think most doctors would speak to people. Sometimes it helps to rant. So maybe a colleague, if something's happened at work, like speak to someone, like try to get yourself calm. Go out and try to have fun over the weekend when you are not working. Yeah, basically.
Yeah, thank you so much, Dr. Yvonne. All the doctors will answer, so I don't know why Mustapha decided to throw this question to you, because we need to know how all the doctors manage and stress and prevent burnout.
I'll go next.
As you know,
because I know even if I don't go next, if I don't go next, you're going to mention my name anyway.
Well,
anyways, I think it's an interesting topic because doctors are told, or they are seen, that they are supposed to behave in a specific way in the community. And that sometimes puts a lot of pressure. I've never been to a club in Switzerland before. Once, when I decided to go to a club, I entered the club and then immediately somebody said, "Hey, doctor." I'm like, "Oh." So I immediately, with time I left. But then, you see, she comes to the next consultation and says, "Doctor, I saw you at the club." So it's a lot of pressure left, right, and center. I remember even during my medical school training, I went to sit on a seesaw. And I was doing seesaw up and down with my lab coat. And that day, my teacher saw me through the window. And when I came back to class, she gave me absent for that class. And she was very annoyed that what perspective am I giving to the patients that come? Because it was a pediatrics hospital. Mm-hmm. So how will I be able to explain to the mother of the child that this is the right thing to do, or that is the right? How can I make the woman get confidence in me if me myself during breakdown I'm doing seesaw up and down with my tiny body already? I look like a child, so I fit in very well. So for me, what I mostly do is thank God I have friends who are doctors as well. We call each other, and sometimes that's when it's a little bit easy to be a male. You call each other and then you make fun of each other. You laugh at each other, and then life continues. Apart from that, I am not able to dance anyhow in public because people look at you and are like, doctor, with a specific mentality. And even here in Europe, you have it because you're expected to get to a specific standard. So apart from that, I don't exercise a lot. Honestly, I advise people to exercise, but me, myself, Charlie, body na yemre. But I talk a lot to my colleagues. And then I meet people, and then we have a good conversation. My mother is my number one psychologist, a psychiatrist. So we have conversations when things are coming up. I can cry to my mother and so on. So that's what I do.
Okay, interesting. Dr. Blessing?
To be honest with you, I have never witnessed what they call burnout or stress whatsoever. Maybe because I'm loving what I'm doing. What I've worked, let's say Sundays, if I'm on duty, 24 hours, and then I stay on Monday and work till 3 o'clock. This is like 35 hours. That's what I have done. But even with that, because I don't know whether because I'm young and I want to learn, I love going for surgeries. So I don't really see that as a stress because I'm more happy going to cut and stuff. So I don't know. For now, I have never experienced what they call like a stress. Maybe I feel sometimes I feel tired, but I'm always happy going to the OR, going to assess because I'm always learning. I want to learn. So, and that has put me in a very good position between me and my bosses. So, this guy is strong, a very, very good position. This white people, after 8 hours, they are tired. You understand?
Thank you. We are old. We are very old.
The way he said you like to cut. I said, you doctors, talking to you guys, is just, wow. Cut.
I think all this while that you've been talking, AKOSUA is just waiting to say, at the end, you all are saying the same thing. We don't prevent stress.
No, I was actually going to say.
So for me,
Dr. AKOSUA was right from the beginning because everything I'm hearing from you guys is we can't do it.
I will experience that, but for now, because I'm loving what I'm doing, I've never experienced that for now. Let's say for now, yeah.
Okay, Dr. AKOSUA, seems like Dr. AKOSUA doesn't manage stress.
No, honestly, I understand where Blessing's coming from because I remember as a foundation doctor when I didn't have a family and when I was like, I was in a surgery which lasted for like 12 hours and I loved it. At the end of it, like everybody was like, oh, and I was like, give me more. I was like, I was ready to go again. So I guess if you love what you're doing, you actually, as much as this is the thing, you don't think you're burning out, but you do. You are burning out, and like your body does get weak and stuff like that. And that's how, if you end up then going into a department, like the next day I was in clinic, and I don't like clinic very much because I like theatre more. So the next day I was like, oh, such a boring day. But you will find anyway. The point is, I think the burnout for me comes more from sort of managing family, home life, and professional life. And honestly, there's nothing that you can do. I know that they say so in the UK, I don't know what other places have, but we have, like in West Midlands, we have a team of professionals specifically for mental health for doctors. So you can actually go and talk to them and sign up to them. You can be signposted to them. But again, coming from, I think it's difficult being a doctor because it's almost like, how they say doctors that are the most difficult patients, like I know what I have to do. But the funny thing is I don't have time to do it. The other day I was thinking of, okay, maybe I need to take a week off, or I need to take 2 weeks off. Who's going to give me that week off or 2 weeks off? Even 1 day off, you're trying to get 1 day off. I was literally trying to get 1 day off for Christmas to spend time with my family, and they're telling me I can't even do that. Imagine going and say I need 1 week off for your mental. It's funny because they tell us that this is available for us. We can do this, we can do that, but it's not available. So thank you, Alexa. So at the end of the day, it is what it is. We burn out, we dust our feet, we get up, we go again. There's no such thing. There's not really anything for us. We're just here. Hard truth, but it's the fact.
Oh, okay.
And Comfort said as well, teasing each other is a way of managing stress. It's true. Doctors are known to be very We tell it how it is. We say anything. Like I know, like I was having dinner the other day, and there's a thing, something came online. I think it's this news, and there's like, you know, bombing and everything, and then like people's legs were broken and there was blood everywhere, and I was literally sucking this bone, and then my husband was like, "How can you eat?" And I was like, "How can I not?" Like, you know. So it's, I guess we become desensitized to things as well, in a way. Not a good thing, but it happens. Yeah, it is what it is.
Hey, thank you, doctors. Honestly, the answers were quite depressing to hear. But
sorry to depress you, but it is what it is.
We'll speak to the doctors to hear how they manage it so we can manage it. So for the audiences, let me break it down for you guys. To manage stress, let's not listen to the doctors. They're doing what they have to do. We thank you so much for your services and what you do. But to manage stress well, please do. I mean, there were elements of things said in here. Do talk to people. Do go out and have fun. Do spend time with your family. Definitely take a break. Don't like keep working. Definitely take a break when it's needed. And when you just can't do it, yeah, just when you get to that point, just say, the body can't do it, take a break and go and just have some fun. I just wanted to ask, there are a few questions coming in now. This is very interesting, but just on the topic of what Dr. Mustapha experienced in the sense of that level or expectation that society places on you guys. Do you guys experience that as well, that you can't do certain things like go to the club or just have fun? Because it's not wrong to actually be on a seesaw, but I suppose as a mother, I should walk into the playground and see my pediatrician. I mean, I wouldn't think he's incapable of. I wouldn't think he's incapable of doing the job, but it would just be a funny sight to see. I guess.
I mean, we've got a few hands up, so I don't know if we maybe get to those questions and stuff, because we could go forever and I think there's some in the chat as well. So I'm just mindful of the time as well. But just to quickly say what Mr. said in terms of that's why now you remember, like I've always said that I usually don't listen to those things. I'm very much me. Just last week we went to my cousin's house, and one of my cousin's friends is a nurse, and then she came in and she was like, when I see AKOSUA, we don't even see her as a doctor. Like literally I walk into A&E. She literally said, it was like, we do know the nurses were always looking for the general surgeon doctor, and then AKOSUA's just there and she's just sitting there like this and she's waiting for us, and then when we're done she's like, I'm here, and nobody actually looks at her and thinks she's the doctor. And that's because I refuse to live by those standards given to doctors. Are expected to operate at such high standards. Like I have a life and I plan to live it, hence red hair and I don't. So Mr. if that was me, I would be on the swing every day. That's me. But sorry,
he was marked as absent. I don't think he'll be doing that.
You have the BMA to hear from. Anyway, let's move on.
But yeah, no, thank you so much, doctors. Let's swiftly move on. Miss Abena, thank you so much for your patience and for waiting. Please go on.
Hello, good evening, doctors. Good evening, everyone.
Good evening.
My question goes to, I think, Dr. Blessing. Since this has got to do with my bones, so you are an orthopedic doctor, I think my question will go for you.
AKOSUA is here
I have a problem with my lower back.
Okay.
I used to say it's my waist. Even in my teenage years, when all my friends or other girls were having problems when they have their periods, it was mostly the abdomen. Mine was my waist. I've been feeling waist problems. Even when I was pregnant in Ghana, they were saying, oh, because you have your baby in your waist. I've been having all these waist problems up until now. Now that I'm growing, I think the pain is also growing. Because the pain is so intense sometimes and so painful sometimes. And I reported to my doctor some years ago, and they checked, and the doctor said, oh, it's not my waist, it's my spine. Because I used to say it's my waist, and they said, no, this is not your waist, it's your spine or your lower back. Now, I've been on painkillers on and off. Now, they've taken decision for me to go for a surgery. I've done MRI scans, X-rays, lumbar, everything. And they came to a conclusion that I should go for a surgery. So recently I met a consultant to briefly tell me whatever is going to happen in the surgery. And what came about was there are some risks involved. One of the risks being bladder. I can lose my bladder. I can also get infection and paralyze. Those three, when I heard the third one, I said, no, they shouldn't tell me more. They should, in fact, maybe they can print everything and then post it to me for me to read everything. But I didn't get whatever I said they should post. But I think these three were enough for me to just tell them that I have to come back and then think if I want to go ahead with the surgery. And also, I've been hearing people, whenever someone asks me, oh, how is your back or how is your waist? And I say, I'm going for a surgery and I'm deciding. Some people, our community, sometimes they tell me, no, don't go for it. You might be paralyzed. Sometimes they tells me to, recently a friend told me, oh, she knows someone who passed away going for a surgery like that. So I am scared, to be honest with you. I don't know. I'm still deciding. As I said, I've seen this. So they're giving me up until March.
Okay. But in case I may ask, are you shy to say the diagnosis that might help a lot?
Sorry, can you come again?
Is it possible maybe you can say your diagnosis in case you're not shy of it? But if you are shy, it's fine.
The diagnosis, it's just my lower back.
But lower back, lower back, like the MRI you did, of course, will come out with something.
Yeah. When I went there, there was these images on the screen. There's a hole, actually a hole at my back, that's spine. There's a hole. They said they have to replace it with something, operate me and replace it with, I don't know. I have no idea what it is. Okay. And my question is, should I be worried about any replacement at my back?
It depends. As I said, it depends on the diagnosis, first of all. Let's first rule out the diagnosis. And also, it might depend on your age. Sometimes, if you're too much or if you are old enough, for me, for example, my boss always tell me okay, no, this patient is not good for surgery because of age. Age-wise, I can show you several scans, 85-year-old, they have a shoulder fracture, or of course, going for shoulder replacement, the infection, the paralysis, they are all there. So sometimes they just do conservative treatment. Just do it without any surgery. Just go for physios and stuff. So as I said, I'll be very happy if I might get your diagnosis. But if asking me of the risks, of course, any surgery comes with the risk. Even taking a mere medicine, taking paracetamol, it comes with a risk. So we always weigh the risk and then the benefits of the surgery. So if you're young enough, and then you are in your working period, of course, for me, I suggest go for the surgery just to prevent the pain. But if you can bear the pain throughout your entire life, fine. But if you cannot, just go for the surgery. Sometimes the doctors will tell you, okay, there is this risk or that, but trust me, they will do a better job. So first, if I get a diagnosis, I will give either to go in for the surgery or not. And there's a woman who have to go for hip replacement here, and her BMI is 41. And then no doctor is trying to take that patient. They tell her go and lose weight. If you lose weight, if it comes to 31, 37 BMI, we'll do our best. But 41 plus, no doctor want to do the hip replacement for the patient.
Okay. They also suggested
for the back pain, for now, just go for physio at least. Just go for physiotherapy.
I've done physio. That's me. I've done because I've also have this arthritis, so I'm doing physio even at the moment. Yeah. So they also suggest I should come for maybe a vaccine sometimes. injections.
Like start
to ease the pain.
For example, like Mustafa always fight with me. I love the cats, so he doesn't like. He likes the medicine aspect. I don't like the medicine.
Just to add up to what Blessing just said, it's normal to be scared. And if I were the one who is going to have a back surgery, I'll be scared like hell. And yes, I have seen patients that 100 patients going for a surgery, one patient having total paralysis and everything. But there is a good percentage of a success. And any surgeon that goes to a room, that's why there's a God factor in everything. Any surgeon that goes to a room knows that there is a risk, and they would definitely tell you the risks here and there. However, it is very subjective. I mean, how do you feel? Is this pain killing you? Are you tired with it? Are you fed up with all these things? Secondly, it is talking with your surgeon and having a global overview of the case. Then after that, you make the right decision. Because sometimes I might just sit here and say, don't do the surgery. But I don't know, maybe you cannot live with the pain. So you just need to sit down, pray to God, and then get God's guidance in this, and then have an in-depth conversation with the surgeon to understand the statistics, what percentage undergo these things with difficulties, know the surgeon's reputation, and after that, make a decision with God's guidance. Thank you.
Thank you. Thank you very much. Thank you, doctors. Thank you, everyone. Thank you.
I had wanted to come in before, but I don't know for time, so maybe, okay, Abana, fine. Go.
No, you can go ahead. I was also going to make a suggestion, if it's okay with Dr. Blessing. You can take this backstage and maybe figure out the diagnosis and the images or something, and give like direct advice if you are okay with it, Miss Ma'am.
If only you'll be able to like send images, I'll be happy.
Yeah.
See, this is what I'm saying. You see, these European doctors, they don't understand how UK system works. She will not be able to send you images, okay? Because
I'm saying even here, even my boss will not even send you. They'll always let you see it.
Yeah. So this is like, and this is the thing, right? This is what I wanted to give a bit of UK. I don't know. Actually, Miss Haben, are you from the UK? I assume you're from the UK.
Yes, yes. I'm in UK. Yeah.
So the system works a little bit differently. So there were three things I wanted to add, and I'll be really quick. But the first thing is, number one, I think knowing the diagnosis would be very important, because initially when you were talking, because you brought in sort of the childbirth aspect and then the hips, I was thinking it was something like endometriosis. So, but then obviously then you talked about then MRI has shown that there's something in your spine. So right now we don't know what it is.
It's actually a hole, like a hole. Yeah. So they say when I make a move, it just squeezes like.
Yeah. Yeah, but this is my point. We don't know where the hole is. Is it in a muscle? Is it in a bone? So, but the point I'm trying to make here is it's really difficult to advise on not having the full details. But in terms of the surgery, yes, surgery is scary. But there are three things I want to advise you the next time you talk to either of your doctors. The first thing is your GP is always there to help with things like this. So if you're concerned about a surgery or you're concerned about something, the same way that you've come to talk to us, make an appointment with your GP, go to your GP. And the reason I say your GP is because surgeons want to cut. Okay, so sometimes surgeons will give you an option, but they will give you an option to do the surgery. Your GP is a neutral person who might be able to say the same thing we're saying to you here. They will say, how bad is the pain? You've been living with this pain for 40 or however old you are, 40 odd years, or however old you are. Do you feel this pain is something that is okay if you continue to take painkillers and taking physiotherapy? In that case, then maybe the surgery is not indicated. If the surgery is indicated, then obviously your GP will go through with it. So that's the first point. The second point, when you speak to your surgeon, what exactly are they saying? Listen to what they're saying. Are they saying that I have to tell you these side effects because there are side effects of every surgery? Because whenever I do a consent form for a surgery, I have to tell the patient everything that could go wrong. So even with a C-section, I have to tell you that you could lose your baby, you could lose your bladder, you can lose your legs, you can become paralyzed from a C-section. But we know C-section is something that's very common that we do all the time, but we have to give you that information. So when your surgeon is talking to you, listen to them. Are they giving you that information because they have to give it to you? Or are they actually saying that this is something I am worried about this particular surgery, and I think you need to be worried about it as well? So that's the second thing you need to think about. And then the third thing is you need to ask your surgeon, what's the percentage of this happening? So for example, if they talk about the bladder being cut, ask them, okay, if you do 10 surgeries, out of 10 surgeries, how many times is a bladder cut? If you do 10 surgeries, how many times do people become paralyzed? Because from that, you'll know the percentage. Again, if they come back and they say, oh, I've done 100 surgeries in my whole life and I've never cut a bladder, you know that is a side effect that they have to tell you about. It doesn't actually happen. But if they say, actually, this particular surgery, every time I do it, 5 out of 10 patients bladder cut, and you know this is something that's happening all the time. Again, that will help you make a decision. So that's just 3 tips I wanted to give you the next time you talk to your doctors.
Okay.
Can I just add something?
Yeah.
So I've got issues with my internet. I'm not really sure if anyone said it, but I agree with you about the options. I've heard a couple of people say physiotherapy as well. There's another one, chronic pain management, that GPs can also refer you to. So it's sort of a clinic where they teach you how to live with pain, basically. So in the event that you choose not to, so first of all, make an informed decision, go back to your doctors, speak to them, ask them these questions, and then sit down and decide if you want to go ahead with it or if you must go ahead with the surgery. Fine. If you also decide not to, there are other ways of dealing with pain long term. So I just wanted to add that.
Okay. Yeah. Thank you. Thank you. Thank you, doctor. Thank you, everyone.
No problem.
Yeah, thank you, everyone. So basically, okay, I am speaking, sorry. So we are pressed for time, but I would like to go through the questions that are there. So we're going to go to Auntie Liz first, and then the 2 questions. There are 2 questions in the chat, which I'll pick up, and then I think we'll close with that. So that will be it. So Auntie Liz, please.
Yes, Dr. AKOSUA brought me direct to the question I want to ask. I don't know about those who are not in UK. And Midlands is GP easily seen because you said talk to your GP. Because in London, to get to sit down with your GP, that's something.
Yeah.
And now I'm hearing some people, you join the queue. I don't want to bore anyone. From 8 o'clock. And then you are number 25. If you're lucky, you get to your 10, it's 4.
True.
And if they give you, the receptionist is, I hope my surgery, nobody from my surgery is here. Receptionist is asking you, why do you want to see a doctor? And then sometimes you're given outside your GP doctor, or somebody will call you from only God knows what. And now some people, you have to go through a link and fill a form. My aunt was beside herself. Put everything down on your form, and the form will then tell you whether you need to see a doctor or not. So please, Dr. Abna. No, Dr. Abna, hey, my doctor.
I can help you in this one because me, myself, I experienced.
No, Dr. AKOSUA, Dr. Yvonne. I don't know about Dr. Blessing and Dr. Mustapha where you are, but in the Midlands, do you just pick up the phone and you are giving GP appointment to sit down to discuss important issues like this?
Okay, please. I think when Monday or last week Friday, I had an experience with a GP. As I said, I myself am a doctor, but like I wanted to start driving, so they said I should go for examination, see my eye and all other things. Trust me, I have called this doctor almost like 20 times, like just pick my call.
And
trust me, since then I don't like people who said we want to be GP. Now, but Mustafa said want to be a GP. Since then, I've never liked Mustafa in my life.
Hey, bless
oh, don't be like that. No,
even me, bless you, even me.
This GP, I'm not.
However,
no, Dr. Blessing, please let me say this. So when somebody said when you are burnt out, I'm thinking, do they get burnout? Since COVID, they've never been in the office, always working from home.
I don't
Where is
know
the burning out?
I don't know that work. You know.
So let me come in on this one, right? I think there are different moving parts of it, and Yvonne, you can you can chip in as well. So number one, yes, I had the same feelings because my GP is actually still in London. I'm still registered to my GP in London, and yes, it's still very difficult to get in touch with my GP. But after doing my GP placement, in fact, I've realized that the receptionists, they do a very good job. Like when I was on my GP placement last month, I was calling in because I was late, and I wanted to call the GP, the surgery, to tell them that I am running late. I was on the phone. By the time I reached I was late, but I reached the GP, I was still on the phone. So I called up to them and I said, I tried to call, but I'm on the phone. So then they gave me a back number. They said, no, don't use this number in the morning. Because
you see?
So they gave me a back number, but that's for staff to report if they're having any problem to come in and stuff. So, but the thing is, honestly speaking, I don't blame the receptionists after working in a GP practice, right? Every day when I get into my GP, I have 10 patients to see in the morning, 10 patients to see in the afternoon. Every morning when I sign in at 9 o'clock, my patient, it's full. I see at least 20 patients a day. And
you sit down face to face?
Yes, face to face at my GP practice.
Okay.
But I also do phone calls as well. I know some GP practices have now moved to telephone triage. So what they do is the doctor will speak to the person on the phone first and see if they need to come in. And because honestly, a lot of the time, some of the things that I see in my GP practice, sometimes I'm angry that I'm seeing these things. I say, I could have done this over the phone. I don't know why I have to come and sit here and waste time. This is the truth. And the annoying thing is the kind of people that were coming to the GP. So there are several people that I see at least 3 times a week, 4 times a week. And even me, I ask myself, how do these people get appointments? Because I don't know how they get, because there are people, but that's the thing. It's usually people who have a bit of time, people who are a little bit more flexible with their time. So that, there's anyway, long story short. Yes, I said see your GP. In my practice here in the West Midlands, there's an old woman who gave me a bit of a chicken. I'm going to tell you here, okay? So you're not going to take this anywhere. If this is on YouTube, but basically, what the old woman said to me was, she said she basically walks, and I don't know if it'll work for every GP practice, right? But she said because she can't get through on the phone, at 8 o'clock, she just walks into her practice and she says, I've been trying to call you for the past 3 days. I really need to see somebody. So I've come in to just make the appointment. And then she'll go back home. So she'll come into the GP practice, she'll make the appointment, and then maybe they'll give her later on, they'll give her 1 o'clock, 2 o'clock, but she's there making the appointment physically. Not everybody can do that. I know they're not, but if you can, maybe try it, because it's true. If they say the phone lines open at 8 o'clock.
Dr. AKOSUA, my GP, they said don't come in unless you have appointment.
Of course.
And then you get there and they tell you, all the GPs, we have only 2 doctors in, and it's all booked. So it would be waste of your time.
It's different, and honestly, it happens the same everywhere, even here in Midlands as well. So
I will strongly advise you to move to Switzerland. We do not experience. We do not experience
everything, and just pass me the
let Yvonne talk, or do you want to talk and then Yvonne? Yeah, let Yvonne talk first, and then you can.
Hello.
Yeah, go on.
Yeah, we can hear you.
Yeah. So I'm not really sure if it's a general thing. For my GP, when I call, I normally get an appointment. But
in Midlands, yeah?
Yeah. Mm-hmm. But I've had patients come in and then they vent out their anger at me. Mm. It's like, I had one woman, right? I saw her for say 30 minutes, and she spent 20 minutes just
complaining about.
Yes. That day, I just sat down and allowed her to vent, because I was like, I don't even know you, but all the anger was directed towards me. I don't know if it's, but I feel like it's a general problem.
Yeah. But see this Auntie Liz, you keep saying about how you don't know if the doctors are working, because but we really are working.
Well, no, I know you're working, but then working from home, how hard can that be?
I've never worked from home my entire life.
In the Midlands, yes, you don't work from home.
We don't
Come
work
to London, they are all working from home. That's why we don't get appointments.
I agree with you because Akos is planning to start working from home when she's done with her training. I think
Dr. Mustafa, you see, oh.
Is this true? I was just going to say, Auntie Liz, I think that, well, I didn't even know that there were still telephone conversations going on.
Where do you live
on.
now?
I live in London, and for mine, we triage, like Akos was saying. So you would have to fill in. You would have to fill in a form, and then when you fill in the form, within 24 hours, you will hear from them. If they need pictures, they will ask you for pictures. And they would then
you're dying.
So this is what I was about to say. I think when you're dying, you don't use the GP system.
No,
I think when you're dying,
it's not everything that you need to go to A&E.
No, not A&E. Call 111 because
111 sometimes will direct you to the GP. And then they can even come back and tell you, I've been calling and nobody's picking up the phone. Haven't you heard that before?
No, not with 111, because with my GP I have, when I needed something urgent, I remember they were like, oh, they'll get back to me in 2-3 days. I was like, well, in 2 to 3 days, this and this. And they were like, well, if it's serious, call 111. Or if it's serious, then go to A&E, as you'd say. So with 111, I haven't had to call 112 too often, but I have called them once. But I think for now I'm used to the way my GP system works, and luckily I don't have anything serious that I need my GP.
Another thing I just kind of want to just mention, I know this might seem a bit insensitive, but the thing is, the thing that you might feel is serious to us. I'm just trying to say. So, for example, when we are triaging, and this is because that's they have things they ask. So if you're having because again, we've had people come into the GP practice who've said or maybe exaggerated their symptoms because I've got because they want to be seen, and then when they're seen, it's like actually this could have waited, and then this and then the emergency ones are actually not being seen because of things like this. So again, I'm not saying that it's not important to your GP. It is. But I'm saying that sometimes the things that you might feel that are very urgent can actually wait 2 or 3 days. And that's why we might put you 2 or 3 days back. But if it really is urgent and you call 111, there's no medical professional who will triage you over the phone and say this is an important thing and then say they're not going to see you. It just doesn't happen. So if you're not being seen, it just means that we feel like you can wait a little bit longer.
But please, trust me, no matter how our course will try to explain, the GP, they are so full of themselves.
Yeah, I don't get it too. Well, not the words that you're using, Dr. Blessing, but
they are so full of themselves. For example, Mustafa. So
you know what? First of all, let's try to understand that there is a shortage of medical personnel and doctors and GPs. So that's the reason why, one, there's a lot of backlog that they need to catch up with. I'm also very frustrated with the system.
Dr. Abner, you are wasting time here. Why don't you go and help them out?
I would love to.
Let me just give an example.
I would love to, but I am not a medical doctor.
I'll give one last example and then we'll just... Right, so there's I now work in pediatrics, right? And the other day I was on a night shift. And when I walked into the night shift, literally, they said the waiting time was 3 hours, which was okay. So some people who came in waited. But as the night shift went on, so usually during the day, there are about 4 doctors. And then after 10 o'clock, it's just for 2 doctors. So 1 resident doctor and 1 senior doctor. So I was a resident doctor. And so the 2 doctors, so then the waiting time jumped to 6 hours. And as the night went on, emergencies kept coming in. So then the waiting time jumped to 12 hours.
Wow.
There was a lady who was waiting in A&E, and she came to us and she said, when I first came, you told me the waiting time was 3 hours, so I was happy to wait. But now you're telling me the waiting time is 12 hours. How? I've got a little child, she's going to sleep. So the funny thing is, we had like 60 patients waiting for us in A&E. There were only 2 doctors looking after 60 patients. And what you have to understand is with every patient, I take at least an hour because I'm taking a history, I'm doing an examination. If the patient is sick, which if they're in A&E, they definitely are sick, I need to give them oxygen, I need to give them prescription. By the time I'm done with them, an hour is gone. So you won't believe that by the end of the day, we had 60 patients initially. When we came to the end, we had about 30 patients left. Why? Because 30 patients ended up saying they cannot wait for 12 hours, they're going to go home. initially they thought the problem was so serious or it was such an emergency that they have to come to A&E. But as they were waiting there for 12 hours, they realized actually it's not that deep. I'm going to go home. And this is exactly what happens with the GP practice. Usually a lot of people feel like my symptoms are so bad, I need to go and see my GP. I need to see my GP now. But you find out after they've waited 2 or 3 hours, 4 hours, actually, his symptoms are not even that bad. Actually, he's gotten better after. And then so this is the trouble that us as doctors are facing. Don't get me wrong. I'm not saying that you shouldn't go into. I just think that the whole system in itself needs a revamp. But honestly, I've been a patient before and I'm a doctor as well. From both sides of it, it's really difficult. So, I'm not taking either side, but I'm just saying I know it's hard. So we apologize on behalf of the National Health Service.
Okay.
I
think I don't buy this thing.
Thank you very much.
I don't buy it.
Come on, Uncle Sam, you pay me like.
Well, yes. I had another meeting which was important, so I finished and then I come on. I mean, I'm just saying that I worked in national health before I went to social health. I mean, we worked very, very hard. I mean, it wasn't like this. Things have really gone bad. And I think somebody needs to, hold on and do something good. We have been hearing these excuses for so many years. I mean, I'm on retirement now. I didn't work to come on retirement and to hear all these excuses and the rest. Come on, get people in there. You don't give them the right salary and all their incentives and the rest, and you expect people to stay there. So please, don't defend this. And our National Health Service is really at the bottom.
Daddy, I agree with you. I don't know the UK, but I can assure you the system are working. But just that sometimes the doctors, the GP, they are so full of themselves. That's one I can assure you that.
Hey, Dr. Blessing, one day you
not the GP. It's the
why are you picking on my doctors like that?
Yeah, it's not the GP. The system and things are. Yes, as Daddy said, we I think we need to channel it to the right places so that we can get the right people in and get the system. It's the system and not the doctors.
Don't blame the.
So can we get the health secretary here? Maybe Uncle Sam can pull strings to get the health secretary, and we will tell her or him the word.
I haven't got that capacity.
Oh, come on, Uncle.
As I will strongly advise, move to Switzerland. You would have premium healthcare. Thank you.
Dr. Mustafa, I'm coming.
We will be here to receive you with open hands. Thank you.
Thank you very much, Dr. Mustafa. Thank you. I hope you're also giving us work permits and whatnot. Please, we need to move on. We need to move on, guys. Sorry. We've got 2 questions. So this one came into the Q&A. Sure, the person wants to be anonymous, I think. But so could you explain the rationale for cervical screening and when screening is stopped? Some ladies are refusing to have it. So what is the rationale behind cervical screening? I suppose, why is it important? What is the rationale behind it? And when it is stopped? Do we understand that question?
Why some ladies are trying to refuse it?
Yes, some ladies are refusing to have it done. So why are they trying to refuse it, basically? Yeah.
Mustafa, of course. Where's Bajo?
Women's health is not something I'm very good at, but what I can say about cervical cancer, cervical screening, is that, the whole idea is to catch on something before it gets worse. Because cervical cancer, I think, is either the first or the second most common cancer in women. So what the healthcare system is trying to do is to catch it before it gets worse. And we say it's normally caused by human papillomavirus. And, sometimes it's It's not something you see with your naked eyes. And we have not developed any smart way to do the screening maybe once a year, once every 10 years or something. And that's why we are doing it a little bit more frequent. And I think with time, when science gets to that level, we might be able to do it just like the way we are doing colon cancer screening. Now we've developed smarter techniques like colonoscopy, and then we do it after every 10 years. However, the test we had before was just an occult test to check whether there is blood in your feces, and that one we are supposed to do it every 2 years. As technology advances, I think things would improve. It is important because you can easily get, it's the most common cancer. So the best thing we can do is to build up preventive measures. And why people are not doing it, I think it's because, sorry to say, but it's quite annoying that you are in good health and then you just have to go and lie down somewhere and open your legs for sometimes a male doctor to put something inside your cervix and then take. I mean, you are in good health. Nothing is wrong with you. Why are you supposed to do that every year, every 3 years, or every now and then? So that's why I feel people are not, if they don't see the imminent danger, they don't do it. But it's just good to do it because it is the best way we can screen or we can prevent future cancer.
Agreed. Thank you, doctor. I would usually move on to other doctors, but we are pressed for time. So we'll go on to the next question, which is, how do you manage hernia after surgery?
I'll take this since it's the surgery. I love this. Yeah. Although I'm not a general I'm not a general surgeon who does hernia and stuff, but I have a friend.
Like, you love to cut. Yeah.
So
answer that question, Blessing.
So it is very important after surgery. Like you have to have a good rest, regardless. Like I don't know what type of hernia, but that's the type of hernia I'm talking about. So regardless, you have to have a good rest. And sometimes if you have like abdominal hernia, like mostly.
Listen, wait, can I just, you can answer the question, but I just want, Ajwa, can you clarify? Do you mean that the hernia was gotten after the surgery or the hernia was already there? But how do you manage the hernia after you've had the surgery? Please clarify the two. Continue, Lesson.
Yeah, so basically, what to do after hernia surgery, I'm saying from an angle. But basically, you have to have like a rest. Rest is very, very important after every surgery, regardless. And then depending the type of hernia, have like a good diet. For example, if you have an abdominal hernia, you have to make much of like fiber, because after abdominal hernia, you don't have to have like constipation. So it's advisable to like a good amount of like fiber. Sometimes we send them for physio. Just so physio doesn't mean like have a good what you can go about the day and day like activities. Not necessarily means like going to do, but at least having your normal walk-ins, doing your normal strength, just physical gym and stuff. Not have a vigorous gym, but at least doing your day-to-day activities. Yeah, basically dieting, like take your drugs that your doctor might prescribe for you. And then, yeah, after hernia surgery, like a day or two, you're okay. You're clear off to do your normal things.
Yeah. So just from what Ajwa has come back to say, so the hernia is after the surgery. So this is common. Anytime that you've had abdominal surgery, the abdominal wall muscles become weakened, which means that your bowels can then protrude through the sort of where you've had the surgery. So that it can be common. The fact that you say it comes and goes is also a good sign. It means it's a reducible hernia. It means that we're not worried about it. It's not strangulated. It's not being sort of cut off. So usually, whoever your surgeon was depending on how long you've had the abdominal hernia for. If it's quite recent, your surgeon should be keeping up to date with you with this hernia. We usually don't do anything about hernias unless they become sort of a problem. If they become too big, past a certain size, if they keep coming out and it's not able to go back in, we call it an irreducible hernia. Again, that we might look at that, or we might even monitor that. Or sometimes if they become strangulated, that is basically if they become too big and the opening for them is tight, so it squeezes off the the bowel loop. So what I'm saying is right now there's nothing to do about it. It's just to observe it. You keep an eye on it as well. Symptoms I want you to look out for are things like vomiting, nausea, not being able to pass any gas. So if you're not farting and if your bowels have not moved for more than 2 days, you need to go and see somebody immediately. I say 2 days because you've got a hernia. For a normal person, if you haven't gone to the toilet for sort of about 5 days, will be the cut off, 5 to 7 days. But if you've got a hernia and you haven't gone moved your bowels for about 2 or 3 days, then I will go and see somebody just to get assessed for the hernia. And I think I'm going to leave it there because of time.
Sorry, muted. Trying to get myself off mute. Oh, yeah, we are really pressed for time. There is a hands up, Letty. I hope it's a very simple question.
Yes, it's very simple.
Okay, lovely. Shoot, please.
In my GP, we have only 10 minutes.
Yes.
To speak to the GP. But my problem is, if the reason why you went to the GP first, if you have a second issue and you want to talk about it, immediately the GP will say, oh, no, you have to book another appointment. Why is that? Because if you can see the person, why should the person go and then come again? Does it mean that means you have to have, the person have to book an appointment so that you have to be getting jobs every day? Or I don't get it. So if you can explain, Dr. Akos.
I think Dr. Blessing should stay out of this one, Dr. Blessing.
Okay, let Yvonne and I'll if you want me to, I will explain it, but let Yvonne go. Yvonne, you're on mute.
Sorry, I just need to step down for a bit. I'll be up in a bit.
Oh no, that's fine. Then I'll take it. It's fine. Go on.
No, I'll talk.
Debbie Blessing, stay out, please. Or question for GPs. Okay, so again, very good question. Now, for example, the reason we say that is the number one thing I would say is if you have more than one thing to talk to your GP about, tell the receptionist, because that's how usually if somebody comes in and they say they've got 2 things, the reception will allocate them 20 minutes. The reason for that is I explained that when I see a patient in the hospital, it takes an hour because I have to do this, that, and that. When I see you at the GP, it's even the 10-minute GPs have complained about 10 minutes. Trust me, my GP practice has complained about 10 minutes so much. We've actually moved us to 15 minutes now. So we get 15 minutes per patient and we're still trying to fight it because for us doctors as well, we don't get enough information. If you think about a hospital doctor has as much time with a patient as they can. They can ask as much questions. We as doctors are detectives of the body. If you come to me and you say something's wrong, I need to ask you questions in order to find out what's wrong with you. If you tell me I've got a headache can be anything. I need to ask you questions. 10 minutes is not enough for me. Then I also need to examine you. Then I need to come up with a diagnosis. Then I need to write your notes. And if I need to refer you anywhere, I need to write your referral letter. I need to write your investigation letter. I need to do all of this within 10 minutes because then I have my next patient. So if you then say to me, which a lot of my patients end up doing, after I've dealt with all of this and I've hit my 10 minutes, or maybe sometimes I'm even over. Sometimes I'm at 15 minutes and I'm okay, thank you very much. And then you say, oh, by the way, doctor, I also have toe problem. I don't have the time because my next patient is waiting outside and is already angry that they've been waiting in the waiting room for over 10 minutes now. You guys have to understand this. This is not something that we want to happen as well. We're very annoyed with this, but we can't do anything about it. So if I now say to you, okay, fine, you have a toenail problem. Now let me take history for this toenail problem. This will take me another 10 minutes. The person outside is now waiting for 20 minutes. That means that if I do that for every patient, that means I'm going home at 7 o'clock when I finish at 5 o'clock. This is why the only way to get around this is if you have more than one problem when you talk to the receptionist, say to the receptionist, I have 2 problems. The receptionist will book you in for 20 minutes because they know that's how long it takes us to deal with 2 problems. But if you only book in 1 problem and then you try to squeeze one in, it's not going to work because we don't have the time, unfortunately. Thank you.
Okay, thank you.
Akos, you have.
Oh, Dr. Blessing.
Because Blessing, you're not a GP. Blessing, you're an orthopedic surgeon. I've worked in orthopedics before. You guys, it takes 30 minutes to lift up just one leg. Just to check what's wrong with the leg. So if we have 10 minutes, we can, and the funny thing is, anytime that we refer people to secondary care, so if somebody gets a knee replacement, what do? They come to the GP first. The funny thing is, all hospital doctors talk about how rubbish GPs are, and they talk about how GPs should have never referred this case to hospital. Guess why I referred it? If somebody comes to me with knee problem and I have 10 minutes to take the history and do examination, when I do the examination and I find something wrong, I'm not able to do an x-ray there and there. So I have to send them into secondary care. If they come in and you do the x-ray and you find out, oh, they just have arthritis, oh, GP is so rubbish, GP cannot even tell the difference that this person does not have, because I don't have time. If I had 30 minutes to look at the patient like you do, I'm sure I would have been able to tell the difference between
that's not my issue
and arthritis.
Of course, my issue here is that, honestly, I agree with the how you've explained yourself with the time and everything. That is so right. But trust me, GPs are so formed.
We can understand your concerns. However, Abena would proceed. Abena,
thank you. Please, thank you very much. We're not here to fight between GPs and whatnot. GPs are doing a wonderful job. Okay, they are doing what they can with the time that they have. We are very pressed for time. Amma, I hope this is a very, very, very quick question or addition or submission.
Good evening, everyone. So sorry. I couldn't come on early, and I'm really interested in what Dr. Kos is saying, but I think I'll leave my comments for now.
Oh,
because of time.
We are so sorry that you couldn't make it early.
It's going to be like, I do understand what Dr. Akosua is saying, but my biggest issue is that the GPs are missing very, very important issues because of the time. And I believe that when I was working and I as a health visitor, when I was working as a health visitor, what I tend to do is we are being given 90 minutes to do a new bed visits.
Thank you.
And with the 90 minutes, and we've got KPIs to meet. So with the 90 minutes, especially if you work in Newham, as a health visitor, you have to look, when you go into a home, you have to look at, write in the notes or assess all the under fives. Now, I work at home visits. Now you go and meet 3 children under 5, and you are being given 90 minutes. I always I don't want to miss anything. And I always say, when they call me or they pull me up to say, oh, KPIs, you are not meeting it, I really have answers. And no one has fought for me. Because I don't want people to go and come back. And I don't want to miss vital, issues. So the issue is, GPs, you need to fight for your rights.
Thank you, Amma.
Thank you.
Yeah, no, thank you, Amma. So Abena has had to leave actually because she had to go. But I'm gonna close off the show basically. So no, I think we've already actually gone over the time, and we've actually gone over by almost an hour. So gosh, thank you, doctors, for, I know it's not easy to take time out of your schedule, but also thank you everybody who's been here and just sort of kept listening to us talk and fight about things that are probably not relevant to you, but thank you so much for being here with us. Before we close off, usually the doctors would give a little last sort of word or just summarize. So do you guys want to do that? Should I start with, I won't start with Blessing, I'll start with Dr. Mustapha. Any last words, Dr. Mustapha?
Move to Switzerland, please. Thank you. Anyways,
Dr. Mustapha, I'm waiting for the Shito.
The Shito issue, yeah, but it's going to be a long conversation. So we'll talk about that at a later time. Dr. Akos, please make a special session to talk about why Shito can cause cancer. And I'll be very happy to provide my research accordingly. Thank you.
Okay.
Anyways, apart from that, I think thank you very much, everyone. It was a very interactive session. As I always tell Africans in the diaspora, please take your health very serious. When you go, ask the questions. Don't be timid about it. Be concerned about it. Do your research, and then may God be with us all. Thank you.
Amen. Blessing. Any last question? Last comment?
Yeah, we are in winter. Just take good care of yourself. Dress well, like protect yourself, and get free from all these vaccine from cold and flu and stuff. Once you eat well, dress well, at least you can protect yourself from the aspect of infection. So yeah, thanks.
And Dr. Yvonne?
Thank you everyone for having me, and a Merry Christmas to you.
Absolutely. So Merry Christmas to you all. Before we go, just want to also give some announcements to make. Tomorrow is time of Tap Tap Send. We know Tap Tap Send is back now. So remember, if you're sending money to Ghana, use your favorite vendor, use Tap Tap Send. Friday, we also have a time with a lawyer, same time. So please tune in, same link, with time with a lawyer, and ask any immigration question, just like you've done here with medicine. Immigration is also very important. Any law-based questions, so tune in for the same time. And this is the last show we're having for the year with OT Media Health Talk. Next year, we'll be back with more doctors, new topics. If you have any topic you'd like us to comment as to cover, please write on the OT Media WhatsApp group. If you're not on it, we'll put a link on the chat now, or message me on my our social media pages, OA Sisters, Dr. AKOSUA on TikTok. I'll put all the links on the side as well. So yeah, just message us and we'll cover any of the medical health talk shows you want us to cover. But for now, we wish you a very Merry Christmas. And
when are we back?
This will be communicated on the OT Media. I'm not sure yet because of my schedule, but I will put it on the OT Media. It will be in January, probably not the first week of January, the second week of January. But again, I will confirm this on the OT Media WhatsApp group. So please watch the space and see you all next year.
Bye. Merry Christmas and a Happy New Year, everybody.
Thank you.
And see some of you tomorrow, God willing.
Merry Christmas, everyone.
Uncle Sammy, I'm seeing you tomorrow.
The doctor said that if you eat something, you will get cancer. What is it?
It's Chico. And you can cancer.
Who said that?
Chico.
I think, because of Dr. Mustapha was saying that because of the way that we make the shit, or the way we burn the
the oil.
There's something called carcinogens which you get from burnt food, and basically because of the way we burn the onions, but Dr. Mustapha will cover that. We'll bring you there.
Okay, thank you.
Hey, Dr. Mustapha can
Intana bibri.
Oh, when what dear me and I'm doctor no so what dear me no nya adwen.
No, because you be this year.
Hey, Auntie Amma.
You be with the
No, I eat fresh pepper.
Fresh pepper and you better see the fertilizer and pesticides in the one.
Nancy, I know say milk be. No, say
milk. Yes, I just read it today.
Yeah.
Yes, milk.
I'm not going to buy anything from Tesco's and the rest.
But you know the funny thing is, I buy my son's milk from Marks and Spencer because I almost say I know you're organic. He drinks that, me I drink anything, but but I found out even Marks and Spencer.
Marks and Spencer is not good.
They have it in the milk as well. So I said, I've given up.
What is in the milk? Please tell me.
So they now they are treating the cows in a way that they don't want the cows to produce fat because they say the fatting is causing global warming.
Yes,
they are giving them
that warming, global warming, footprint as some.
You're giving them this chemical, almost say and I'm out for say because the animals are not fatting, it's not natural, so it cannot be natural.
Yes.
So
that is why you go for plant-based milk, almond milk.
You better see the pesticides a good show. The main tias kwansi enya kokasa organic asase no ya nananom pensu de no ye de da be na ekotwa asase foforo beto ho entie ye den free. Everybody near Boafo.
Amen.
All right.
That's lovely. Anyway,
Auntie
guys.
Elizabeth, you are going to be a lecturer somewhere because you are really
a professor with
medical knowledge and all the rest.
Uncle Sam, now the nebusia penny to be a new come here to me say.
Now, book, sir, you have to write a book.
Emino, Erade Mami Adrian, I'm in your book for Uncle Sam. I will write you a book.
Thank you, Dr. Akos. Thank you.
Thank you so much. Uncle
Dr.
Sam,
Akos, Merry Christmas.
Yes.
Merry Christmas.
I am Mamunya Finchapa. Echnaya, Ebeshi, Uncle Sam. It's a too important meeting.
Yeah. I had a meeting. I finished at 9:15.
Okay. Good night, all.
Good night, everyone.
God willing, we'll meet tomorrow.
God willing, we will.
Bye. Hey,
Bye.
I have a meeting.
I know. I believe you, Uncle. Good night.
We have convention meetings.
Okay, and say good night to Auntie Lydia for me.
All right, I will. Thank you.
All right then. Bye.
Good night.